One man endures grueling hardships just to make a living.
Yes, sir. Akalimu kamaliza bulungi sir.
Onokola.
In Olwatuka, witness a heart-pounding journey of love.
Ngokomyewo mangu.
Inanga ati ngomtima guliye nebirowoozo byonna nga biriye.
Paliza mule nawe. Nakakonchereketa mwange.
Subambate mpadiko nga mbachiriji. Nga mbachiriji.
Pain, acrimony, and justification that the line between right and wrong has never been so thin.
Maybe I need to remind him who I am.
So, you killed my wife.
Olwatuka film premiere will be on the 3rd of December 2024 at Uganda National Theatre, sponsored by
The parish development model launched in 2022 by President Yoweri Museveni to fight poverty and enhance service delivery at the parish level has disbursed over 1 trillion Uganda shillings to more than 10,500 circles, benefiting over 1 million individuals countrywide. The government of Uganda appreciates you for embracing PDM and using it to move away from Okorera Ekida Kyonka. You are encouraged to continue participating in this journey towards socio-economic transformation.
UBC, inspiring Uganda.
The Journey program on UBC TV is brought to you by Blascon, Color Your World.
Hello viewers, my name is Dr. Kenneth Mugisha. I'm the Executive Director of AIDS Information Center Uganda. I'm a medical doctor by profession and also a public health specialist and an HIV physician with over 27 years experience managing people living with HIV/AIDS. I'm here to take you through a brief journey that AIDS Information Center, also called AIC, has taken over the last 34 years since we were established by the founder, the late Lydia Barugahare, in 1990. AIC was started by the late Lydia Barugahare in 1990, following the death of her husband a year before, in 1989. And because of the stigma and the lack of knowledge of HIV status, she worked with 15 others to establish AIC. And they were not alone. They were supported by Makerere University. They were supported by DFID, the Department of Financial Assistance for International Development from the UK. They were assisted by the Swedish International Development Agency, and they were also assisted by the Ministry of Health and Uganda Virus Research Institute, as well as Makerere University School of Public Health then. So we pay tribute to all those that established this great institution, because this is the nerve center of provision of knowledge for health. Knowledge not just for HIV status, but knowledge for health. And as we know, it's only a healthy population that can be productive to serve their country with diligence. Now, why does AIDS Information Center exist? We exist mainly because we have a vision, we have a mission to accomplish. And our vision is a population free from all preventable health problems in Uganda and beyond. If you noticed, when the COVID pandemic broke out, it was a clear indication that diseases have no borders. So our vision is for Uganda and beyond. We want to have a population that is free from all preventable health problems in Uganda and beyond. Our mission is to contribute towards the elimination of communicable and non-communicable diseases in Africa in a sustainable, collaborative, and integrated approach. We have certain values that we espouse, and these include one, Ubuntu. Ubuntu is humanity. We believe in the African spirit of sharing and being humane to others. That is a core value number one for AIC. The second is pursuit of excellence, and our intention is to provide high quality services. So we must pursue excellence so that we are able to provide high quality health services. Our third value is equity, because we believe that everybody was created by God and should have a share. We do not believe in equality, but we believe in equity. We want to give to each according to his needs and expect from each according to their ability, as espoused by some sociologists or socialists of the past. Our fourth value is strategic partnerships. And in pursuit of the strategic partnerships, we ride on the shoulders of the government of Uganda. The government of Uganda is our key strategic partner. There's nothing that we do without the government. And there's nothing we do without the leadership of the district local governments. There's nothing that we do without the communities. So ours is people-led programming. We lead from behind. And our strategic partnerships span across the civil society, organizations, NGOs that are involved in the HIV response and other sectors. We work with the ministries of government, Ministry of Works. We work with the Uganda National Roads Authority to ensure that even road construction workers are provided with HIV awareness. They get HIV testing. We screen them for STIs, because we know as they build the roads, commercial sex work matches, it goes along with them, and that becomes one of the drivers of HIV transmission in the country. So our strategic partnerships include both the public and private sectors within the country, cultural and religious institutions, the churches, the mosques, and the traditional leaders. Our other core value is innovativeness. We do a lot of innovation, and we are involved in research, working with organizations like the Medical Research Council of the UK, Uganda Virus Research Institute, Makerere University School of Public Health, Kampala Capital City Authority, and many others, to do research so that we contribute to the new body of knowledge to improve the health of the population. And finally, and most important, is integrity as one of our other values. And number 7 is continuous learning. We are a mature but a learning organization, and we learn on a daily basis. Our overall goal is to ensure that by 2030, we contribute to the reduction of preventable, communicable, and non-communicable diseases among the general population in Uganda and beyond by 50% from the 2023 levels. So we want to cut by half the prevalence of both preventable, communicable, and non-communicable diseases by 2030, as espoused by UNAIDS and the Sustainable Development Goals, especially Goal 3. Our strategic objectives during this period will include: 1, we want to achieve and sustain increased access to and utilization of comprehensive health services, and 2, we want to achieve increased levels of awareness for communicable and non-communicable diseases by 65% in the districts and regions of focus where we operate. Currently, we have 8 centers of excellence across the country. One in Arua, we serve West Nile region. We have one in Lira to serve the Lango sub-region, Soroti to serve the Teso sub-region, and the Karamoja sub-regions. And we are actually also the comprehensive implementing partner for the US government under PEPFAR for reaching and sustaining HIV epidemic control in Teso sub-region. So we are managing a 5-year, $32 million grant funded by the CDC, through CDC by the US government, through the generosity of the American people, and we do appreciate their support over the years. USAID played a very big role in the starting of AIC, and CDC since 2004 has been funding our work, and it's the main donor that we have currently. 88% of our funding is coming from CDC, Centers for Disease Control and Prevention, which is an agency of the United States government. In 1996, we had an opportunity to host President Bill Clinton of the United States together with his wife Hillary Clinton. So they laid the foundation stone for construction of this AIC headquarters here on plot 1321 Musajja Alumbwa Road, Mengo Kisenyi, together with support from the German government, and we are greatly indebted to them for contributing to the HIV response in Uganda through this infrastructure development. And we want to leverage on what they put in place to grow AIC even beyond the original expectations. As I mentioned, we also have branches in Kabale. We have a center of excellence in Kabale. We have a center of excellence in Imbarara, and another one here in Kampala, Jinja, Mbale. So we have a national footprint. Our services reach over 15 million people. That's about 33% of the population. It is served by AIC through our network. We have over 15,000 community health workers, community volunteers that we have trained over the years, and we percolate through up to the last mile, up to the household. So our services reach a big segment of the population. And working with the UNRWA, we have also been able to further expand our footprint to other regions like Hoima region, West Nile. Now we are doing a World Bank project where we are providing HIV awareness and GBV prevention, mitigation and response on the NERAM project, Mbale, Soroti up to Dokolo Road. So we are grateful for that those strategic partnerships. One of our strategic objectives, number 3, is to enhance the capacity to undertake research and contribute to knowledge generation in all the intervention areas. While we have been doing much of HIV work, we also do a lot of TB work. We do sexual and reproductive health work. We do STI screening and management. We are now into cancer screening and management, and soon we are bringing machines for cancer screening. We want to start early screening of cancer, because when you screen cancer early, when you get to know that you have cancer early, the medical interventions to treat it actually work, and you can survive longer than when you come in the late stage. So we shall be bringing 8 cancer screening machines for each of our centers of excellence to be able to provide those services. So in addition, as I already mentioned, we are doing research with the Medical Research Council. We are doing research with Abbott. We are doing research with the Makerere University School of Public Health, Uganda Virus Research Institute, and DWB, a number of other institutions and organizations, and we welcome more who would be interested in doing groundbreaking research that is going to improve the quality of care for our people. Number 4, among our strategic objectives is to strengthen the capacity of AIC to lead, manage, and coordinate the program interventions. And we want to enhance, finally, the capacity of AIC to respond and build capacity of partners in global health security. By global health security, we're talking about these emerging epidemics like COVID-19, Ebola, now we have monkeypox, the Marburg, all that kind of disease conditions. And we are also into One Health. One Health is where we are looking at the interface between man, animals, and his environment. And as espoused by Calvin in 1954, he believed that if you want to manage health, then it should be One Health, because there are diseases that are transmitted from animals to man. And those are the ones which we call, in the medical jargon, they are called zoonoses. So the zoonotic diseases, which for instance, you get from a cow to a human being, can be prevented. For instance, the Bahima community, they like drinking unboiled milk. They just get milk right from the cow and drink. But that milk can contain bovine TB. And when you drink the unboiled milk, you end up with TB of the stomach, TB of the abdomen, which you are picking from the animal. So we want to see how we can prevent that. 2, we want to see how we can address antimicrobial resistance. There are so many antibiotics now, but we are abusing them. People are using antibiotics that are meant for treating human beings, and they are using them to treat their chicken, those who are rearing chicken, to treat their pigs. Some even reach an extent of using ARVs to treat their pigs, because the pigs also get viral infections. And when you give a pig ARVs, to grow faster. But that means that the person who, if somebody is HIV positive and they have been taking pork, if they get HIV and you start them on ARVs, their body will already be sensitive to the ARVs, so to be resistant to the ARVs. Same thing with the chicken we eat every day, which we are pumping with antibiotics. So if you get a cough and they give you the same antibiotic, it won't work on you because the body is already what? So we want to do that antimicrobial resistance surveillance, and we are working with the Central Public Health Laboratory of the government to ensure that even the accredited laboratories that we have can do that kind of surveillance.
Tuliko ground, Blascon, paint and win. Yes, yeah, Blascon, paint and win. The cuckoo roundy. Chicho, buy paint worth 100K. Get a scratch card, SMS the code to 7197. Stand a chance to win instant airtime, 1 million shillings bully day there, or a share of a 3 million shillings jackpot each week. What do you want the brand new podas, tuk-tuks, and so much more? Catch the paint and win action every Monday on Bukede One, NBS, and Sanyuka TV. Blascon, color your world.
Also, we need to introduce you to. We need to introduce the concept of climate change and health. We all know that the climate has changed. The seasons have changed. When we expect rain, it does not come. When we expect the sunshine, it does not come. Instead, it rains. And it doesn't rain, it pours. It is floods everywhere. We are getting landslides. Now, therefore, as a population, we must be sensitized to know that a healthy planet is what will secure the health and well-being of us as the population. So in pursuit of such intentions, as AIC, we are interested in integrating climate change into our health programming. So for this 1 year alone, we shall be on a campaign to plant 1 million trees across the country through our 8 branches, and we appeal to those who are willing to contribute to the seedlings. Especially we are interested in fruit trees, so that our children can enjoy those fruits for their nourishment. You know the benefits of the vitamins that we get from fruits. Yeah, so we want to plant 1 million trees in this 1 year alone, and we are looking for sponsors to do that. 2, we have the World AIDS Day coming up. World AIDS Day is celebrated on the 1st of every December. And the theme this year is collective action, sustain and accelerate HIV response interventions. So I want to appeal to the key stakeholders. One, I want to appeal to the government of Uganda, because as an institution, we also have challenges that we have been facing over the years. One of them is the dwindling donor funding. The donor funding is taking a downward trajectory. And as we inch towards the end of the HIV/AIDS epidemic, much of this donor funding is going away. So for sustainability, because we cannot lose all this investment over the last 34 years, we'd like to appeal to the government of Uganda, especially His Excellency General Yoweri Kaguta Museveni, the President of the Republic of Uganda, as the leader who has pioneered the HIV response in this country, to know that we need to secure the future of the population. It may look like we are getting to the end of the HIV epidemic, but development alone, as we are witnessing, also contributes to new HIV infections. Because people are moving from the rural areas to settle in the urban areas, because there is electricity, there are social amenities, there is water, borders, and some of this is contributing to urban poverty. Poverty, ignorance, and disease move hand in hand. So we want to appeal. One, we are having a wage bill deficit of over 1.2 billion shillings accumulated over the last 1 year. And yet we need to continue providing these essential services to the over 15 million Ugandans I've told you about. So we are appealing to the Ministry of Finance, Ministry of Health, to support us obtain a government subvention, so that the government meets at least a part of our wage bill for us to continue serving the population. But also, there are other mechanisms that we would want to use, because the other option that we have looked at together with our board of trustees is establishing specialty hospitals. So we have 2.3 acres of land here in Kampala, Mengo Chisenyi, where we want to build a 14-story hospital that will be providing specialized radiological and diagnostic services, and as well as specialized services across the various medical disciplines. We also have an intention to build another one in Mbarara, or AIC Mbarara Specialty Hospital. We have 1.6 acres of land just opposite Ntare School, and we are looking for funding to build that. And also we shall be building another one in Lira City. So the AIC Lira City provide specialty hospital will also be constructed by 2026. So this is the artistic impression for the AIC Mbarara Specialty Hospital that we intend to build. It will also be 14-story, and we shall be providing high-class, state-of-the-art radiological services ranging from PET scans, MRI scans, CT scans, ultrasound scans, name it. We shall have nephrology units, we shall have a cancer treatment center here to support the Uganda Cancer Institute because the prevalence of cancers has increased tremendously. Yes, so this is just an example. 2, we have decided to move from being basically an NGO and to register private for-profit companies as we move into a business model. And these private companies are 2. We shall register AIC Holdings Limited and then Trust AIC Foundation. And these will be doing purely business so that the profits that we get that accrue from there can be plowed back into the NGO to serve other people. And these will be companies limited by shares. You can also, as a Ugandan, buy shares. So I want to appeal to you, you can buy shares for the construction, to contribute to the construction of the hospitals, the specialized hospitals. Each share will be 10,000 shillings, and we don't mind the limit of the shares. It could be the only inheritance that you leave to your children, and you will have scratched a mark on the history of this country to say that I am one of the owners of this hospital that is providing quality health services to the population. Finally, we shall be starting a school health program. We want to start a school health program. Why? Because we are noticing an epidemiologic transition from communicable diseases to non-communicable diseases. These days, the parents who have money transport their children to school in the morning and bring them back in the evening. And before they go home, they take them via KFC and Cafe Javas to buy junk food, chips and chicken, ice cream, name it. And then these children go home to watch TV. They don't exercise. They don't do any work at home. It's done by the maids. Now you are finding children in primary school who are obese. They are overweight. So you are building candidates for non-communicable diseases, high blood pressure, diabetes. And we are increasingly seeing children who are having juvenile diabetes. And diabetes is a very, very complicated disease to manage. Some of you pay very high, exorbitant school fees in private schools for your children. But these children never receive screening, regular screening, to know which disease conditions they are suffering from. So, under our school health program, which we have agreed to pilot starting with the schools that are owned by the Roman Catholic Church, we are going to be doing screening at the beginning of every term. We screen your child for TB, we screen your child for cancer. If it's a girl, we screen for breast lumps. We also do provide HPV vaccination for those who are eligible. HPV vaccine prevents cervical cancer in women. For the boys, we provide voluntary medical male circumcision for those who are eligible. We shall screen for dental conditions. We screen for skin diseases, screen even for eyesight. So when do you get to know that your child is losing their eyesight? Sometimes you take too long when in actual fact it could have been prevented. So we shall be providing this package as a school health program package to those eligible, but at a cost. At a cost. Or we shall start with the private schools. We shall be able to deworm every beginning of term, to deworm all the children who will be receiving our services, and also educate them on nutrition and adherence counseling, because people now are more interested in junk food, chips and chicken, but that is a recipe for disaster, especially if you are not exercising. If you eat this junk food, you need to exercise, but you eat the junk food and then you sit in a car and drive home. We need to educate you about diabetes, for example. Diabetics should not be going to saunas. Now it is common. When you go to the sauna and you sweat, you reduce the blood volume and the blood sugar goes where? goes high. So you risk getting complications. You risk getting into coma. You risk getting a stroke. So we want to teach you how to exercise, what to eat, etc.
Why should someone living positive living now not be worried about HIV?
Yes, and finally, and that's very critical. As I speak now, we have over 71,627 persons living with HIV who are under our care as AIC. Now, for me, that is a lot of success that has been managed and brought to fruition by the Ministry of Health. So I commend the Ministry of Health for doing that work. When we started AIC in 1990, there was a lot of stigma. But now today, with the advent of ARVs, a person living with HIV can actually live a better life than a person who doesn't have HIV. So there should be no reason whatsoever why somebody should not come and seek treatment. Everybody should come, you test. If we find that you are positive, we start you on treatment. It's just, you swallow just one tablet a day. And we also have other prevention tools using ARVs. We have PrEP. We can give you PrEP so that you don't get infected in case you have unprotected sex, if you have swallowed the pill. And now we are also bringing injections, whereby we shall be injecting you every 2 months to prevent transmission of HIV. We also have the ring, the vaginal ring, that can also be used by women to prevent HIV transmission. So the prevention tools are there. Condoms, both female and male condoms. And for any person that is living with HIV, if you're on treatment, I want a few things from you. 1, ensure that you take your treatment daily. 2, make sure you feed very well. Feeding well does not mean that you eat meat. No. Some of you don't know, for example, that mukene, silverfish mukene, is very nutritious. It has very good mineral salts that help in treating the nerves of a person. And we know HIV affects nerves. Sukari, diabetes also affects nerves. So I think we need to do more. Ensure that you adhere to your treatment, and ensure that you are checked at least once a year to see where your viral load has reached, because we want you to achieve viral suppression. If you achieve viral suppression, then you are not able to transmit HIV to other people, even when you have a sexual relationship that is unprotected.
Thank you.
I thank you. I want to take this opportunity to thank our partners, especially the Ministry of Health and the government of Uganda, CDC, the US Centers for Disease Control and Prevention, USAID, who are funding most of our programs, UNFPA, ACCORD, VIV Healthcare, Positive Action Fund, IDI, Infectious Diseases Institute, the Uganda Protestant Medical Bureau, UPMB, TASO, Reach Out Mbuya, UNRA, Ministry of Works and Transport, and finally, Uganda Broadcasting Corporation, UBC, for giving us this opportunity to share our journey over the last 34 years. So in case you need more information, or you'd want to get any information and services from AIC, my phone contact is 0783 691 001. You can either call or you send a WhatsApp message. I will respond. For those on Airtel, 0701 367757. And our head office is here on plot 1321 Musajja Alumbwa Road, Mengo Chisenyi. Thank you very much. Have a good day.
UBC, inspiring Uganda.